Hello everyone. So this is my video on the podcast that we were assigned to listen to, which I did mine on 219, which is about ADHD treatments. So it was hosted by Jackie, Ron, and Diana, who are a lot of the hosts for the ABA podcast. It was a live recording episode, so it wasn't like script or anything. It was just straight up live. They discussed 4 different articles. Fiftner and Hack from 2014, so a pretty old article. They discussed about flowchart behavioral management strategies from Dan and Forth in 2016, effectiveness and specific techniques in teacher training in a micro trial by a bunch of names I can't say, but from 2021, so a little bit more recent. And then I don't have the author's name, but it was actually a article on fidget spinners from 2022. So as all of you guys probably know, fidget spinners were so huge when we were all in high school, or most of us, I should say. And what they started to discuss was ADHD, which is attention deficit hyperactivity disorder. So they first started specifically on what that was and how it's seen in young children. Even though it can be diagnosed throughout the lifespan, like we've been discussing, and inclusivity, if anyone has taken that class or is in it right now, that symptoms have to be before the age of 12. It is an executive functioning disorder, which is about 5% of the world's children, which is a huge number when we think about it. Right now it's of impaired levels of, I believe they said the combined type is 10 to 15% among ADHD children. So a very large pool, and often develop oppositional defiant disorder, and other additional disorders. So they first and foremost discussed how overall behavioral treatments were effective, especially when it came to parent training. So what they were talking about, especially in the article, they mentioned like challenges in parenting. So parents engaged in ineffective and inconsistent strategies. So usually if a kid has ADHD, there is a very large genetic connection, which I can relate to personally, as I do have 2 parents who both have ADHD. So let's do the math. So typically one parent has it and it creates a large fight. In both personal experience and what they were talking about in the podcast, typically one parent is very similar to the other and they both struggle with the same problems, but one is older and has kind of found a way to cope with these problems, and sometimes that coping doesn't match up because what works for my dad might not work for me. So a lot of what they discussed were preventative treatments were the way to go. Because especially undiagnosed, it can lead to a lot of dropout rates and delinquency, and especially in girls, suicide and self-harm. So they really highlighted discussing the article. I believe it was Fiftner and Hack they were discussing specifically, but that not all kids need every treatment option, that they didn't all work, but focusing on how to teach new interaction skills. So not necessarily what the parents were doing, but how they were approaching it. And very similar to ASD, and those treatments might overlap. I did not catch what study he said when I was listening to it. I believe it was Fiftner and Hack again, or it was the effectiveness and specific techniques. But they found that in the study, dads will not participate in effective parenting skills unless a sport is involved. That is from one of the studies, which I found was very interesting. One of the things that I did want to highlight, especially from the fidget spinner article, they did find that it did help. So I think that was very interesting, that the fidget spinner article, it did improve focus and reduce disruptive behaviors in students with ADHD. In its initial findings, it showed some positive effects on task behavior, but it really just depended on the individual. Like Dr. Slick said, it can really just range. Like we can do that behavioral data collection of 2 weeks with it, okay, 2 weeks without it, what were the test scores, and go from there. So they talked about functional behavioral assessments, so identifying specific triggers and to reinforce those behaviors to focus on task completion, as kids with ADHD struggle with actually completing to do things. Not necessarily that they can't or don't have the knowledge or skills to, it's about actually doing it. So getting that first step, which from what we've learned in class, we can use, the working from small tasks to bigger tasks, which personally, ever since I've learned that technique, has very much helped with things that I need to do. Positive reinforcement, once again, going back to that parenting aspect of encouraging those desired behaviors like completing a task, but initially engaging in a positive way. Clear commands and instructions, which is what they discussed in the Mind and Flowchart article from 2016. So using that flowchart and management strategies with both parents, students, and as teachers. So that's something I really took away from this, was breaking down tasks. So step-by-step instructions, which with tools like Magic AI can be made really simple. Like it doesn't have to be something that's extremely taxing that we can do to help our kids. Using visual supports, movies, images, anything but just words on a page can really help a kid with ADHD. And sometimes setting realistic goals. That can be a really hard thing as a teacher when you want them to do a huge project and you want them to see it and do this small thing, but realistically, what do we think they're actually going to be able to do for said project, which is, once again, something that I'm learning for myself of how to set those realistic goals. And having in a supportive environment, because those interventions and preventative measures can drop a lot of those really nasty stats that I've mentioned earlier. But overall, positive reinforcements, fidgets, individual level, it kind of just depends on, especially in the later findings. But initially, especially with the fidget spinner article, they did have a somewhat positive effect. And eliminating vague commands and just using specific commands. So overall, yeah, really enjoyed the podcast about ADHD and was very helpful.